Sir, with all your permission, sir, it's already 3. In just few seconds are left. I'm starting this session, sir.
Okay, okay.
Good afternoon, everyone present here. I welcome all the participants on today's session. And let's welcome today's speaker with great honor, Dr. Murugan Sangarnathanam, sir. Sir has a former professor at Department of Dermatology and Venerology, Sri Mumbabika Institute of Medical Science, Kulesekaram, Kanyakumari District, Tamil Nadu. Presently senior consultant in HIV and sexual medicine, Trinavelli, Tamil Nadu. Former national president, Indian Association for the Study of Sexuality Transmitted Disease and AIDS, IASSTD and AIDS. And today he is going to discuss on a topic influence of STIs, HIV on marriage, intimacy and parenthood. Let me tell you overview of the topic. Human immunodeficiency virus, that is HIV, infection remains an important public health concern in many countries. It is fueled by gender inequality and disparity, which has been resulted in a fundamental violation of women's human rights. Several studies have been also associated with domestic violence, increased divorce rate, and forced abortion in case of section of society. To learn more, I would like to invite Sir and hand over this session to Sir. Over to you, sir. Kindly proceed from here.
Good evening, everybody. Good evening, friends. I first of all thank Faraz and IJCP Medno for giving me an opportunity to meet you all in this pleasant evening. I will share my screen. Actually, every physician, it will not be difficult to treat the condition, diagnose the condition, treat the condition. But nowadays, because of the advent of the globe becomes small village, because of website, online informations, and whatnot. So people are coming to you with so much of knowledge, and they will search and they will be disturbed and they will come to you and ask for so many questions, sometimes for which we may not be in a position to answer. So about this, we are going to talk today. Following an STI, following a HIV, whether before treatment or after treatment, the patient will come with flow of questions, flow of doubts we have to answer, apart from treating them. So that is very important, especially the common functions like sexuality, marriage, and parenthood, and intimacy, sexual intimacy, all these things about which we are going to talk now. Sexual feeling is an instinct, like just like eating when you are hungry, drinking when you are thirsty, as attending nature's call, like that. It's a basic function of the needs our body. Cannot be denied when it is needed. It is universal for all living creatures. You can see in the picture. So today, what we are going to talk about is resuming sex life after treatment for sexually transmitted infections. Sex for the people living with HIV, whether they can have sex, whether they can produce young one. Advice for marriage, concordant couple, discordant couple. Concordant couple means both the couple are reactive for HIV. Discordant couple means one of the spouse is reactive for HIV, another spouse remain non-reactive. And the need for baby. All these things we have to address. Sex and marriage advice for the phobic patient. Some patient may not have any disease at all, but they will have severe phobia, and sex after tear genitals, ordinary thing, quite common. So that also has to be, we have to address and we have to convey. How it is important in the management of STI. Partner management is a part and parcel of STI. Without partner management, the STI treatment is not complete. Unlike any other infection, unlike any other pathological conditions, sexually transmitted infection is very, very important to treat the partner, both are all the partners together at the same time. Otherwise, your treatment will not be complete, it will be failure. And moreover, by treating the partner, examining the partner, we are rendering the patient uninfected is an important. We are not going to produce any new cases. So this is also very important as a public health need of our nation. To achieve this goal, correct advice on the sexual needs to be addressed. As I told already, sex is a basic instinct. So at the same time, we have to consider all these factors, public health aspect and other things. And what are the things needs to be cared? Sex means it is not only genital contact. It may be anal contact. It may be genital contact. It may be oral sex. So because of that, I put GOA. Genital, genito-oral, genito-anal. Apart from this, all these three things are very likely to be risky when it is with unknown person, when it is with multiple persons. Anal sex is more dangerous than vaginal sex. Oral sex is comparatively less dangerous. Masturbation is completely safe hand job, whereas people ask about kissing and breast sucking. So there is a part of sexual activity about which we will see later. Important points to be pondered. Idea behind the sexual abstinence during treatment. The sexual abstinence during treatment is a very important thing. It makes us aiming the spouse to remain infected and to achieve the fast cure. How to be sure whether the partner is non-infectious? One thing is by examination, any finding. So in the absence of any finding, sometimes female examination may not be as visible as in men. So in that case, we have to go for test for cure. But the test for cure is not available for almost all the diseases, most of the sexually transmitted diseases. HIV, Herpes Simplex virus, Hepatitis infection. We don't have test for cure. Certain conditions can be treated to the point of presumptive cure. In syphilis also, there is no test for cure because the organisms cannot be cultured. Likewise, many other organisms are there apart from Trichomoniasis pallidum, Calamity, the fastidious organism, and many viruses like human papillomavirus cannot be cultured. So we don't have any test for cure. Serological test also will not be so reliable. In that condition, by experience, a lot of studies, we are assuming the presumptive cure and we are following that. Certain can be cultured. For example, gonococcal culture is available. Ducrey bacilli or Haemophilus ducrey bacilli can be cultured. Trichomonas can be cultured. Chlamydia can be cultured. Urea plasma ureaticum cultured. Gardner vagina or even Candida can be cultured. But the fact is, the problem is, these culture facilities are not widely available. It will be available on demand or certain only bigger laboratories, not all referral laboratories. So that is another hindrance for us. Smear examination is not alone 100% foolproof. Either wet smear or dry smear, it is around 40 to 50% reliable. So in this juncture, we are going to deal the patients. And with all these difficulties, extending correct guidance on sexual needs of the STI patient is really a tough job. We will come by one by one diseases, and most of the diseases I will try to cover. And syphilis is one of the commonest STI. Syphilis can be treated to the point of presumptive cure, as I told already, because Trichomoniasis problem cannot be cultured. Early syphilis is treated with single injection of penicillin, whereas the late syphilis is treated with 3 to 4 injections, 3 injections weekly once. Textbook recommends a cure can be ascertained 2 years after the completion of the treatment with periodic follow-up and after a CSF examination at the end of the 2 years. But it is practically very impossible. So no patient will wait up to 2 years. No patient will be followed up regularly. So in this juncture, what we have to do? Early syphilis consists of a single injection of penicillin or 15 days doxycycline. Penicillin has an activity for 2 to 3 weeks at the maximum. And the replication time of the Trichomoniasis problem is 33 hours. So 4 weeks after the treatment, after the completion of the treatment, there is no action for the drug. There is no presumptive, as there is a presumptive cure by experience, by learned people, by studies, various studies, by decades and centuries. So we can believe that and advise the patient to have sex after a month, provided the partner also treated. For example, if the one patient is syphilitic, proved, another patient is non-reactive, that is discordant, in that condition also, it is better to give a epidemiological dose for the non-reactive patient for the safer side. Then we can allow them to have sex after a month after completion of the treatment. So that is the idea. As there is no resistance to penicillin so far reported officially to the Trichomoniasis, it is not bad to advise them to have sex a month after the completion of the treatment. This is with regards to syphilis. Late syphilis ceases to be infectious after 2 years. Horizontal infection, vertical infection, both are very rare possibility of 2 years. It's a cell that is infectiousness of the individual ceases. Both the partners are being treated with injection penicillin weekly, 3 or 4 weeks, doxycycline macrolides for 30 days. If at all there is an infectivity exists, it will be over within a month following treatment. Once again. So after completion of the treatment, usually late syphilis, the infectiousness is not there. Even if there is infectiousness there is after 1 month, there will not be infectiousness after following treatment. So after the completion of treatment, that is after 30 days, we can allow them to have sex. So far, no relapse has been reported because of this. Then parenthood. Baby can be infected with syphilis in utero through placental transmission. It is a mandatory that all the antenatal women should undergo screening for syphilis and HIV twice during pregnancy, first trimester and last trimester. The first trimester, if there is already infected, we can treat earlier. The last trimester, if it happens to get infection lately, then also we can try to treat them. So syphilis is a treatable disease. So the birth of the congenital syphilitic baby is absolutely preventable. Even if the baby born with syphilis, then also it can be treatable. The problems with the syphilis serology, there is an interpretation difficulty. The specific test like TPHA or a CORD test may be reactive even after completion of treatment, but it is not to be worried. This non-specific test titer will come down and settle within 6 to 9 months, whereas the specific test will be persistent forever, not to be worried. Poses problem to immigration. So immigration also, the patient, if a patient is tested for specific test, it will be showing reactivity. And even if we are giving explanation, the immigration officers will not agree. So sometimes it has to be declined and the patient no longer infectious, but he has to accept not able to go. Response to treatment in non-specific test, when it will become reactive, it may take primary syphilis at least 3 to 6 months, and secondary syphilis, it may be taking up to 1 year, and late syphilis, it may be even longer. So that also we have to know, and we have to accept, we have to expect. We cannot expect a non-reactivity following a single injection or 3 injection completion. So that's a important thing we have to know. Then gonorrhea. Second most common disease is gonorrhea, major disease. Resistant to antibiotics is not uncommon with Neisseria gonorrhoeae. So we don't know the treatment is complete or not because of the resistance, but usually certain areas only previously resistant penicillin no longer used and quinolines no longer used. So we are using now third generation cephalosporin, which is still B sensitive. It is usual dictum to review the patient after a week after the treatment, either with syndromic management or etiological management. Culture of the gonorrhea is possible, but it's not available widely, as I have pointed out earlier. So wherever it is possible, we can go for test for cure by gonococcal culture. If it is not available, it is not possible, we can go for the urine deposit. Presence of pus more than 5 indicates still the patient is having some sort of infection. If it is less than 4, nothing to worry. Or sometimes threads or turbidity also indicates the patient is having still some problem. So if it is clear, there is no thread, no pus cells more than 5, we can be sure the patient has been cured. So that is an indirect way. It can be applied also to Trichomoniasis, a parasitic or protozoal disease. Test for cure with culture modified diamonds is available, preferable, but when it is not available in small places, then the patient once again can go for examination of the deposit, presence of organism, or presence of pus cells, or presence of threads. If it is all absent, we can allow them to have sex, and after a week after the treatment. So that is very important. And partner treatment is a must in trichomonas, because in women we can demonstrate the organism in discharge, whereas in men it may be remain silent, may not be able to demonstrate. But in spite of that, it is better to treat the men also. In chlamydia infections, whether it is a non-specific non-gonocoerythritis or lymphogranuloma inguinale, single dose treatment is available, multi-dose treatment is available. Azithromycin 1 gram, 2 grams, and multi-dose doxycycline. So test for cure has a little difficult to have. There is no culture freely available. PCR tests are available, or IgG, IgM available, but all are difficult to have. And see the urine deposit once again after a week of treatment, presence of pus or threads. So this way they can ascertain that the patient is cleared the infection. So we can allow them to have sex after months. So that is another thing. Then Granuloma Inguinale is not common nowadays. Long course of treatment is necessary till complete healing. It may take up to 2 to 3 weeks, more than 3 weeks. And test for cure is not available. Ask the individual to wait for 2 to 4 months, the incubation period. So after that, it will not recur. And the partners should be examined, especially female partners. Internal genitals, speculum examination should be there to be done. And if there is no lesion, even after 2 months after the completion of the treatment, then the patient may be allowed to have sex. So that is the idea. Chancroid, partner should be examined, should be treated if necessary. Individual can resume the sex after complete healing occurs. Here, the incubation is shorter, just a week. So not necessary to wait for 1 month or so. Complete healing occurs without any scar. Then the patient can have sex if the both of them have been ascertained, treated. Ectoparasitic disease, that is pediculosis pubis or pubiculaus. And the treatment of partner, family members should be ensured. Ensure the patient complaints, dresses should be washed and heated, the sunlight, dried in the sunlight. Relief from the symptom will take longer, more than 2 weeks or 3 weeks. So complete relief of because of hypersensitivity. The total relief of symptom, we are ascertain, we are eliminate the infection. Then the patient may be allowed to have sex after 3 weeks. Now coming to the viral STIs. Viral STIs, HIV, genital herpes, cannot be cured totally till date. HIV is a chronic disease, manageable disease, has to be continued treatment forever. Genital herpes, there is no known treatment to prevent the recurrence in genital herpes. Certain patients have recurrence. Subclinical human papillomavirus infection is also known, but many people have attained a cure following treatment with genital warts. Patient have to live with these conditions, and the role of condom can reduce the transmission, but it cannot be completely prevent as that for gonococcal or syphilis or hepatitis. But condom can prevent the infection, cannot prevent the infection totally, especially uncovered area of the genital herpes or even genital herpes. Totally, it's not cannot be prevented. Sexual life, but it will definitely reduce risk. Sexual life with AIDS. AIDS is a chronic manageable disease, I told, and the advent of highly active antiretroviral drugs revolutionized the life of the PLHV and made their longevity comparable to the individual who is not having HIV. Once they gain healthy life, sex becomes an inevitable need. Need for the concordant couple, discordant couple, those who are seeking for children and unmarried to have to be addressed. All these things, very, very important. And one should know if when you are addressing these things about the prophylaxis. Start treatment immediately as early as the diagnosis is complete. Undetectable, make them undetectable, viral load undetectable with the appropriate antiretroviral drugs. Undetectable is equal to untransmittable. So when the patient's viral load becomes undetectable, the patient is no longer can transmit the infection. So that is a good advantage. And so the drug is itself as a prophylaxis. And post-exposure prophylaxis, doctors are sexually assaulted or sexually promiscuous individual, and they can have post-exposure prophylaxis for 4 weeks, and it has to be started as early as possible within 72 hours, and 3-drug regimen, 4 weeks. That is a post-exposure prophylaxis. Pre-exposure prophylaxis, this pre-exposure prophylaxis is for homosexuals and sex workers and discordant couples. One couple is reactive, one of the spouse is reactive, one spouse not reactive. All these people have to take these pre-exposure prophylaxis continuously as long as they're sexually active. It is not on demand basis. It has to be taken continuously. On demand, not on demand basis, because when they fall for sex, we don't know. Or any opportunity, every opportunity, any minute. So the patient, the individual has to take the prophylaxis. Once started means they have to continue as long as they are sexually active to make them uninfected. Concordant couple. So even concordant couple, both are reactive. In that case also safe sex is advisable. Without safe sex, they are not allowed to have sex, because one individual may have higher viral load, one individual may have lower viral load. So the progression of the disease may be altered according to the higher viral load person to lower viral load person. One more thing is the resistant strain. One individual may have resistant strain, another individual may not have resistant strain, that may be transmitted. So that is another thing. So because of that, always safe sex is advisable for the concordant couple also. The only thing is, so that is the important thing. Discordant couple. So discordant couple, we have to keep the uninfected partner to be uninfected forever. That is important, sir. So we have to put them on pre-exposure prophylaxis lifelong as they are sexually, as long as they are sexually active. The safe sex is a must, and so thereby we can prevent the new infection, public health aspect. Now, the question is, even the having this children, having children is a social pressure in our community. They cannot tell them we are HIV positive, so we are observing sexual abstinence. So individual, the other people may not be knowing. So every altered person will ask for, are you having children? Why you are waiting? Are you taking treatment or not? All this nonsense, all the doctors advice, all these things will be there. So even though we are counseling them, after some time they cannot resist. They want to have children. So what are the availability? If the male partner is reactive, the sperm wash technique and intrauterine insemination can be taken when the wife is non-reactive. In case of wife positive, husband remains free, safely IUI can be performed. And after the ART to the wife. In concordant couple, render them undetectable viral load for both and allow them to have sex under the cover of HAART, that is highly active antiretroviral drug, without condom during fertility period, that is U is equal to U. That is undetectable is equal to untransmittable. Short exposure. But we are not allowing them forever. During fertility period, they will be allowed to have sex. And thereby they can obtain conception. IVF procedures with vast sperm is an alternative that also can be applied. Unmarried person, once again, the social pressure for getting unmarried. So if the person is remaining unmarried, everyone will ask for why you are remaining unmarried, like that. So can't reveal to everybody that sometimes even the parents, I'm HIV reactive. So parents also may not be able to reveal. So try to convince against marriage, but it will be difficult to hold them unmarried. If I fail to convince them to get married, PLHIV. Suppose if they are not able to motivate in the long run, at least they can marry another HIV patient. Thereby, they will not be producing a new HIV individual. That is the important thing. We have to advise them. Especially MSM patient or heterosexual patient, they may not be stick to one partner, they will be often changing. Herpes Simplex. HSV2 is a sexually transmitted infection, and HSV1 is not a sexually transmitted infection, but can be transmitted through genitals, through oral sex, or to mouth by kissing. So that is very important. And HSV1 is not uncommon. And recurrence in both is a rule. Both the HSV1 and 2, recurrence is very common. There is no foolproof method is available to prevent the recurrence. All the antivirals can suppress the infection as long as it is present. When it is withdrawn, recurrence may likely to occur. Infectiousness can persist in the absence of active lesion due to viral shedding. We don't know how long viral shedding is there, how far viral shedding will be there. So that is another important thing. But at the same time, so these are the questions asked by the herpes simplex infection. Whether I can get married, whether I can resume sex with my partner, can I have a baby, the chances of the baby to get infection. Even though herpes, neonatal herpes is often talked about, it is not quite common in our country. Only thing we can, if the patient is having more than recurrence more than 4 to 6 times in a year, then we can put the patient on suppressive therapy for a year or two. That will make them rendered non-infectious. And one more thing is, we have to understand there are a lot of people, thousands of people living with HSV smoothly, and they have happily with their spouses and children. So it is not a life-threatening disease. And neonatal herpes is not so common in our place. So this is the message we have to impart to these patients. HPV, human papillomavirus. So it is one of the cause for carcinoma cervix. So the disappearance of the lesion following treatment does not assure a total cure. New lesions may develop subsequently. Persistent of a circulating infection is a possibility. RNA DNA-based nucleic acid amplification tests are available in certain places as a test for cure, but it's not available widely and expensive. Sex can be allowed 3 to 4 months after complete treatment, after the complete disappearance of the lesion. That is why 4 months. So the incubation period is longer, 2 to 4 months. So after that, it is more unlikely to occur because of the old lesion. And stress the HPV vaccination for children, for adults also. Condom sex will reduce the risk. Genital examination for the female partner is a must before allowing them to have sex. Vaccination, there are different types of vaccinations are available: bivalent, tetravalent, and nanovalent. And bivalent is effective only for carcinoma cervix, not for the common benign genital warts. Whereas tetravalent, it can take care of the benign genital warts and also carcinogenic agents, HPV. Nanovalent also nowadays available. And in India, so far the cervaric bivalent was available. It was costly. Now tetravalent cervix is available in Indian made. That is Cervavac, and quadrivalent HPV vaccination. It is just 300 to 400 rupees per vaccine. And it is available. It is going to be available in Indian market soon. Previously, it was 3,000, 4,000 imported one. As per CDC guidelines, even though it was previously recommended only to women, now recommendations go to all children and adults in between the age of 9 to 26 years. Earlier the better. Adults between 27 to 45 years ages also, who were not adequately protected earlier or at the risk of acquiring HPV infection because of their partner, also have to be given this vaccination. 9 to 14 years, 2 doses enough. Whereas if there is above the age limit, then we have to prefer 3 doses. And hepatitis A, B, C, avoid anilingus, hepatitis A and other parasitic infection, STIs. And hepatitis B, C are more easily transmitted through sex than HIV. And a condom will protect the complete absolute protection in offer. Hepatitis vaccination is to be stressed for partners infected with hepatitis B and those who are very promiscuous or these things. Avoid rough sex, as abrasion during sex can facilitate transmission. Condom offers 99% protection against hepatitis B, hepatitis in transmission. So safe sex is a must who had hepatitis B or C. Partner must be informed to have periodic checkup for hepatitis. Oral sex has considerable risk for hepatitis, and safe oral sex is to be stressed. So oral sex also has to be protected, and there are condoms available for oral sex also. Phobia. So nowadays there are a lot of activities, tourism activities, sexual activities are there, international travels are there, massage parlor, lap dance, nude dance, horticulture, chemsex, and whatnot. Other commercial sexual activities are common, and people under the influence of alcohol, they will be used it. Then they will be worrying about that towel, massage oil, and use the same towel, genital contact, masturbation, nipple sucking, all these things they be going on worrying. And the people will be going on testing for themselves for more than many times. Some people more than 20 times, 28 times. So they'll seek help to get married and resume sex with their partners. Repeated counseling is necessary. Sometimes the patient has to be referred to psychiatrist. Sexual trauma. So sometimes you can see here, this is the sort of sexual trauma is very common. Frenal tear or prepucial tear or introitus tear. So in that conditions, the patient has to abstain from sex at least for 3 weeks. If it is not painful, if it is less painful, and if it is not much worrying, the patient going on having sex, it will not heal. So that is another thing we have to advise the patient. Some difficult situation to handle. In late 80s, I had a unmarried HIV positive conductor government bus service. I was able to hold him for unmarried for 3 years by repeated counseling. ART was not available at that time. That is 1987, 89. After 3 years, he came one fine morning with a sickness and told he got married. At that time, at the period, we were not having much girls as PLHV. He was not able to, so we are not able to settle him for a PLHV. And he was not able to withstand his family pressure for marriage for a longer time. They are questioning his virility and they want to make him to go for a sexologist. The challenge made him bored for marriage. So this is another situation previously. Similarly, another man got married in the morning, admitted for acute urinary retention by a surgeon in the afternoon, and he was working at Mumbai, and the test was HIV, then found reactive, nuptial not taken place, and bride's relatives sent to me and in the evening for further advice. Whether they can, the marriage already has finished. In the night, they have to have nuptial, patient admitted. So what best I can give? So I ask them to explain the situation to the spouse, the wife, and if how she is accepting, how she is taking, it is she is the one to decide about this problem. Like that, I have convinced them. Another is the patient, both were living in Mumbai, came to know that the husband was reactive for HIV after a few months after marriage. Wife was fair and good looking. Wife became reactive. Husband died after a few months. Wife's side was furious about hiding the fact that and quarrel was going on. Husband's brother from my place and he wanted to marry her, and the girl was irresistibly beautiful. Wife's side was very happy. In spite of our repeated persuasion, we will not be able to convince him not to get married to the bride. So they are another thing. So these are the situations we have to understand. Young lovers were not allowed to get married by their family due to various reasons. Girl got married to a man arranged by her parents. The boy was known to have HIV after marriage. In spite of treatment, the boy succumbed. The girl also got HIV. After a few months, the old lover boy volunteered to marry her, and they are happy now with the safe sex, now struggling to get a child. So this is another situation. Another thing is, one of the girl who is working for HIV with the NGO, she knows thorough and thorough. Her marriage was fixed, and the husband, that spouse, that groom was from Mumbai. She asked him to have a HIV test, but during talk before previous to marriage, and he accepted. And the next day, the bride, the groom side came with the quarrel, and how dare she is asking for a HIV test, and the marriage was broken. But fortunately, she married to somebody else. Now she is living safely and good. Herpes and marriage, with the availability of knowledge from online, people with the HIV infections are coming with the following questions with many times. Can I kiss my girlfriend or wife? Can I give oral sex with her? Can I have HIV-1 infection? In case HIV-1, and can I get married and protect sex with my wife like HIV-2? All these things. So I used to tell, it is a many patients are living happily. It is a not a life-threatening disease, and during the symptoms, avoid sex. Phobic patient, lot of guys are After massage parlor, experience lap dancing and all these things. And they 28 times one patient had HIV tested 28 times during 2 years duration, all sorts of nonsenses. I touched her secretions, she handled my penis, I contaminated hand, broken condoms, all these things. So we have to treat individually according to the needs and the situation. So sex is a natural drive. Physicians should not ignore the base of the needs of their patients. At the same time, sexual transmitted infection should be careful not to lead a single new infection among the couple or in any population. Appropriate diagnosis and management, partner management, condom promotion, follow-ups, and correct guidance to the patient are equally important. The guidance differ patient to patient according to the situation and their needs. So 95, 95, 95 before 2030, they have to achieve. 90% of the people should be tested for HIV. 90% should be identified and they have to receive HOT, and 90% of the people should attain suppression. That is viral suppression. So that is the aim by 2030. So we all strive hard to attain the goal. With this, I will conclude my talk. Thanks for giving me the opportunity. If you have any questions, I will be happy to answer. Thank you very much.
Yes, sir. Thank you so much, sir, for giving your valuable time and sharing your knowledge with us and making this session informative one, sir. I definitely think this session knowledge is going to help all the participant doctors on their practice also. Sir, as I can see, sir, I have received one question from the participant end. If you allow, can I take this question with all your
Yes,
permission?
yes, yes. Please.
Okay, sir. Thank you so much. Just let me take the question. And the question is from doctor and someone like just let me check, sir. That my wife is from last 4 years having a medicine for epilepsy. Does the desire has been over? What should we do now?
Epilepsy is not a sexual transmitted infection. And she is on epilepsy treatment. There is no, what is there? Her neurologist, what has told, that has to be followed. It has nothing concerned with sex. If she is fit enough, they can have sex. It's not a sexual transmitted infection.
Okay, thank you
Epilepsy.
so much, sir. Yeah, for answering it. I hope the person who have asked this question has received an answer. Sir, as I can see, there is two feedback. Wonderful session and well explained by Dr. Swati. And another one is very important topic to be discussed. And thank you for the session, Dr. Murugan, sir, from Dr. Savedna. Two people has written this feedback. I hope that they have really enjoyed this session and got to know about. The thing is, the topic is really important which need to be discussed so that the people can be also get aware about of it, right, sir? And
Thank
thank you
you.
so much for your time, sir. As there is no more questions, sir, shall we conclude this session with all your
Yes,
permission?
yes, with pleasure.
Yeah, sir.
Thank you.
Yeah, thank you so much, sir. Until then,
Thank you,
take care of yourself.
IGCP.
Yeah, I hope to see you again with different topics, sir.
Okay.
Until then, take care of yourself. Thank you.
Thank you.
Welcome, sir.